Hello, how you doing? I'm Dr. Matt Young here in Young Dental SF in downtown San Francisco. Today I want to talk to you about some of the headlines that have been made recently for the World Health Organization. World Health Organization came out in early August with guidelines where they wanted to have people delay a non-emergency care in areas that had outbreaks of COVID and in areas that were uncontrolled. A lot of the headlines grab this as a delay of dental treatment. And the American Dental Association and California Dental Association have come out strongly in opposition to this. They respect the words of the World Health Organization. World Health Organization is looking at guidelines for the whole world. But areas like here in San Francisco where we're following all the PPE guidelines, we have all the systems in place that we've talked about in other videos. We do our screening process. We have our temperature checks. The PPE that's available, our surgically clean air that comes throughout the office. And the American Dental Association, California Dental Association, and Center for Disease Control feel that dentistry is safe and effective during this time. As dentists, we've been well trained in infection control over the last 30 to 40 years, treating patients with HIV, AIDS, tuberculosis, hepatitis patients, and other issues. So we're very well equipped for this. We've gone through the protocols to be online with the COVID guidelines, and we really do recommend coming in for dental treatment. There's a lot of research now that is connecting patients who have periodontal disease and an increased effect of COVID outbreaks on these patients. In periodontal disease, you develop something called Interluken 6, which is an inflammatory response. The inflammatory response causes inflammation in the gums, which causes the gums and bones to be lost. But it also causes inflammation in the heart, lung, and throughout the body. When patients are infected with COVID, they develop an inflammatory response, and what's called a cytokine release. And when patients have periodontal disease on top of this with Interleukin 6 already in their body, they can develop a cytokine storm. And the storm is what causes a lot of patients to be wound up in the hospital, and sometimes these patients have died as well. They're finding a big link between patients who have this interleukin 6 and periodontal disease and the severity of their COVID outbreak. So we want to make sure that you're in good shape, gums are in good shape. If you do develop COVID and everything else is healthy and gums are healthy, we hope that everything is a more mild COVID response rather than the huge cytokine release we're seeing in some patients. So we do want you to come in. We want you to come into the office and get your routine care and emergency care if you need it. Right now we're in about August, and we will say that come the fall, like November, December, January, this might be cold and flu season. It might not be a good time to come to the office if you are sick during those times. So we recommend getting into the office before the fall, getting things in good shape, getting your routine checkup, getting your fillings done and procedures, and we'll take good care of you. So I hope everyone's doing well, and if you have any questions, feel free to call the office. We're at 415-392-8611. And right here by Union Square in San Francisco. Thank you very much and have a good day.